The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, vitamin K. New evidence for cancer, heart health, and bone health. Your presenter, Ron Hunninghake, MD.
It's really exciting. Today is the 836th luncheon lecture that's been given here at the center since we opened. And so I feel very grateful that the center has this format, because if it didn't, I would not know very much about nutrition. I don't know if you've heard this old saying, but the teacher's the one that always learns the most. So I'm going to have to admit to you that I thought I knew a lot more about vitamin K than I actually did, and in the process of choosing this topic, I specifically chose it because I had heard that there was some new evidence and some really exciting things going on around vitamin K. And sure enough, there is. And so hopefully I've learned it well enough to teach it to you as co-learners. And here at the center, we value our co-learners so much, and so we're very grateful that you're here. But be ready to change some of your old ideas about what you think you know about vitamin K. So today I'm going to start from the very basics to make sure that we're all on the same page when it comes to vitamins. Vitamins are organic molecules required by living cells for health. The water-soluble vitamins, I'm sure you've all heard this, these are the molecules that predominantly dissolve well in water, and they exist mostly in the watery parts of the cells. The fat-soluble vitamins, however, dissolve better in fat naturally, but we find them in cell membranes and we find them in the working tissues of the cells, because a lot happens in the membranes of cells, and we'll get into that a little bit more as we go along. So let's just kind of talk a little bit about some of the classic 5 vitamins. I mean, again, it's amazing to me that the study of vitamins has been around almost for 100 years now, and there's still so much to learn about them. Of course, the first one here that I'm just kind of drawing a line is scurvy, and you probably would all know that that connects with vitamin C. That was one of the very first deficiency nutrients that we were able to identify. Though in our vitamin C book club, we were finding out, well, I guess last Tuesday, that it took over 123 years for the British Admiralty to take Mr. Lind's findings. James Lind was the guy that did the experiment that showed that scurvy was caused by a nutritional deficiency. But it took over 100 years for that information to actually be applied. And so that's scurvy. What about rickets? Who knows which vitamin deficiency that goes with? Yeah, that's vitamin D. And what about up here at the top, xerophthalmia, or dry eye syndrome? That's vitamin A. And how about beriberi? B1, that's thiamine. And then pellagra would be niacin. Now, I hate to tell you, this is everything that I learned in medical school about vitamins. One afternoon we took and had a little discussion about the deficiency vitamin diseases, and this is what we talked about, and that's where it pretty much stopped. So once again, I'm very grateful for the lunch and lecture series to have expanded my learning, and hopefully I'll help you expand yours today. Now, I'm circling two of the vitamins here. Do you know what makes them special? There are 2 of the fat-soluble vitamins. The other 3 that are up here are water-soluble. So let's talk just a minute about the fat-soluble vitamins. So these were discovered between 1917 and 1929. And like I said, we're coming up not quite 100 years, but of time to try to understand what do these vitamins really mean and how can they help us in our quest to stay healthy. The 4 basic fat-soluble vitamins are vitamin A, D, E, and K, or ADEC is a nice little way of remembering that. Here's something that you can take home with you. The fat-soluble vitamins deal with the regulation of protein synthesis. So how your body uses protein is very much involved with these fat-soluble vitamins. And I think some of the excitement around vitamin K is that Vitamin D has been a font of new discoveries in the last several years. All the various things that vitamin D does. Of course, there's a lot of controversy around vitamin E, but it's been around for a while. Vitamin A is very important. But now what we're finding out is that this other fat-soluble vitamin, which regulates some important proteins in the body, vitamin K, has a lot to do with your future health. And we'll talk how that would be. The water-soluble vitamins like the Bs, these form coenzymes. They regulate oxidation, especially vitamin C, and the production of energy. But we're not going to talk too much about them today. So what about A, D, and E? Just the basic three. Before we get to K, what do these three guys do? A and D interact with DNA and control gene expression via several transcription factors. So they're involved in taking the knowledge that's in the nucleus of the cell and transcribing it or getting it out so that the cell can make use of that encyclopedia of knowledge that's in the DNA. So they're very important. They regulate steroid and thyroid hormone receptors. These receptors are specialized proteins. And we're finding out here at the center that the steroid hormones, your adrenal gland, all of the hormones basically many of them have a steroid structure. And then, of course, the thyroid gland itself is very important in regulating energy and how energy is produced. And we'll find out even the thyroid gland has a lot to do with bone health. Most people think of thyroid in the negative sense when it comes to bones, but we're going to find out in just a minute here how it's a very important part of normal bone health regulation. Vitamin E is an antioxidant, but it also controls the synthesis of several proteins as well. So let's get now to the topic at hand, which is vitamin K, a protein synthesis regulator. And this involves the regulation of the synthesis of proteins in coagulation balancing. Now, this is not going to be a surprise because probably most of you, just your basic understanding of vitamin K would include how it regulates coagulation. And anyone who's been to the doctor and had to go on some sort of blood thinner, they've been told to watch out for an excess of the foods that contain vitamin K. So we know that vitamin K has something to do with coagulation balancing. Now I'm going to come back to that word balancing. It's not just procoagulant or anti, it's a balancer. It's very important in terms of bone mineralization. Dr. Don Davis, who will be speaking in a couple weeks, he actually gave a presentation on vitamin K probably about 6 or 7 years ago and talked about it in terms of bone health. But probably I don't know how many of you have heard of it in that regard, but we're going to talk a lot today about how important vitamin K is for bone mineralization and health. The mineral content of your blood vessels and cartilage. While we're talking here, one of the hospitals is sponsoring some testing, and I'm not paid by them or anything, but I am going to pass their ad around and have you take a look at just that picture, and we'll come back to what it means as we talk a little bit more about the mineral content of blood vessels and cartilage, because this has a great deal to do with your health and your risk of various serious diseases. You know, the number one cause of death here in the United States is vascular disease. And so how well your body is able to handle the mineral content of your blood vessels has a lot to do with your future health and well-being. So what mineral does coagulation, bone mineralization, and vascular health have in common? Calcium. So I'm going to give you a little mnemonic here. When you're thinking about vitamin K, think of vitamin K is for calcium. Obviously, I've misspelled the word, but I want you to kind of burn that into your thinking that really how your body handles calcium has a lot to do with how you age and how healthy you will be as you get older. So this should give you a clue that vitamin K is very important in that regard. Now, what vitamin K basically does is it gets calcium inside. Inside of what? Well, if you've got the right amount of vitamin K for you, and remember that optimum varies from person to person, and so we can't always tell people what the optimum dose is for everyone. So, but that's something, as a co-learner, we think you ought to be on the trail for. You ought to be thinking about what would be an optimal dose of vitamin K for me, given my particular health history and conditions and family history and those kinds of things. But basically what an optimal dose of vitamin K through your diet or through supplements, what it will do is it will get calcium into the right places. But if you're deficient in vitamin K, calcium will go to the wrong places. Now, I'm being overly simplistic here, but I want to kind of I want to lay a foundation, because a lot of people, if you just jump into the research on vitamin K, you're not really oriented to what it's doing. But basically, it's a calcium regulator. Through protein synthesis, it regulates calcium, but specifically, it helps you get calcium where it should be and not where it shouldn't be. So optimal vitamin K gets calcium into the right places. There's two basic right places that we want to talk about today. You want it to be properly utilized by your blood, because there are about 8 different proteins that your blood is required to have in order for you to maintain healthy coagulation. So the 8 clotting factors that depend upon vitamin K, that's obviously what a lot of people understand about vitamin K, that it's a coagulation vitamin. And yes, it definitely is, and obviously it's very, very important. But what about the bone? You've got to have vitamin K in order to get the calcium into your bone, and that is a huge problem in our day and age. There are so many people that are having to struggle with osteoporosis and other bone disease type problems. And so there's a very specific protein that we're going to go into some detail on called osteocalcin that greatly depends upon having an optimal dose of vitamin K. So what happens if you're deficient in vitamin K and calcium is getting inside the wrong places? Well, some of the wrong places it can get into, most obviously, is your arterial walls. And that little picture that's being passed around is a picture of an ultra-fast CT scan of a person's heart. And with that CT scan, you can detect calcification in the walls. It'll be coming around. You'll be able to look at it as it gets to you. The other place in your heart that you don't want calcium to go is your heart valves. Which famous First Lady have we heard of recently who's had some surgery done? Yeah, Barbara Bush had to have a valve replaced because of inappropriate calcification of her valve. And certainly what we're finding out is that heart disease is so common that it's not unusual to find calcification in people's coronary arteries or in the carotid arteries, the plaque formation. And so we're going to talk about how if you don't have enough vitamin K, you may be very silently building up too much calcification in your arteries or on your heart valves. Or another place where you don't want it to build up is in your cartilage. A lot of the tendons that surround your joints will become calcified, or you'll have damage of the surrounding synovium of the joint, and that'll become calcified. And these are the bone spurs that can create a lot of problems in the spine, in the various joints throughout the body. And some people even get calcification in other soft tissue areas of their body. So getting calcium where you don't want it can cause a lot of problems. And finally, I'm not going to talk a lot about this, but we learned years ago that if you are building up calcium inside of your cells, that's a sign of aging. And we think it's due to the inadequate production of ATP. There are pumps that keep calcium out of the cells and get it placed into the proper areas of the body. But if you tend to have mitochondrial dysfunction, if you have other problems with aging going on, that will result in a buildup of calcium inside of your cells, and you can use that as a marker of aging. So the term that you might want to put into your back pocket is systemic calcification, the idea that calcium, rather than being in the places where it should be, is starting to go into areas of your body where you don't want it to be, and it's causing you problems of aging. Okay, a little bit of an aside here. This is a vitamin K riddle that I'm going to ask all of you. Why? I've just spent quite a bit of time discussing what a vitamin is, but why is vitamin K not a vitamin? A vitamin is an essential molecule that cannot be produced by the human body. Well, doesn't that fit the definition of vitamin K? Well, the answer is that vitamin K is an essential molecule that is produced inside of the body, but not by the body. Now, how can that be? And so this is one of the reasons why newborns sometimes have to get additional vitamin K. They have what's called a sterile gut. They do not have the probiotics, the friendly bacteria in their digestive system when they're born. And if they're not nursed right away, or if they don't get these friendly bacteria in there, they cannot produce enough of the vitamin K that they need. And so there is a disease, a hemolytic disease of the newborn that results from inadequate vitamin K. And so that should tell us a little bit about why the gut flora, the good bacteria, are so important. 50 to 75% of the daily requirement for vitamin K comes from the beneficial bacteria within the human intestine. Now, I had to change my slide here. I put the word in may come from beneficial bacteria within the human intestine. There is some debate now how much vitamin K we're getting from the intestinal bacteria. I think there's a question about how healthy are our intestinal bacteria these days, and maybe we're not getting the same amount of vitamin K that we used to get. And the type of K that's formed is K2. Now I'm going to go back, as we go along, I'll define the different forms of vitamin K. I'm kind of giving you the story a little bit at a time, see if you can put it all together. 25 to 50% of vitamin K comes from your dietary sources, and we're going to talk about the different types of vegetables and sources of vitamin K, and that's predominantly K1. But proper absorption, this is an important part of the vitamin K story. Vitamin K is fat soluble, so you really need to be taking any vitamin K supplement with foods that have fat in them, because if you have no fat in your meal, if it's a low-fat meal, you're not going to be able to absorb the vitamin K very well. And part of that absorption depends upon your liver and your gallbladder making bile. You have to have bile in order to absorb fats properly. Or if you've got a fat malabsorption issue and your intestines are not functioning properly, this could be another reason why you become vitamin K deficient. So some of the explanations for why we think so many people are vitamin K deficient ties into this problem with absorption that a lot of people have, or they're either that or they're on some kind of a diet that's not giving them enough of the healthy fats so that they properly absorb the vitamin K that's there. And here's another important caveat. Unlike A, D, and E, vitamin K is not stored in the body. You've got to get some every day. So that makes it very easy for all of us in this room to develop a vitamin K deficiency. And that, of course, can have some serious long-term consequences. Now, this is the fun part. You know, I was a chemistry major in college, and I think one of the fun things about working here at the center is I've begun to see how chemistry actually applies. And a lot of people say, chemistry, oh, you know, don't talk to me about chemistry. I don't understand it. It's beyond me. This is not beyond you. I'm going to give you a very simple explanation of how vitamin K not only regulates proteins, but how it regulates calcium. Now, there's a special group that we learn about in organic chemistry called the carboxyl group. And you can see right away that the carboxyl group it looks a little bit like a claw, okay? But it's an oxygen and an OH group. And what happens is that vitamin K, this is basically what it does. You can really reduce it down to this simple thing. Vitamin K takes one of your amino acids, glutamate, and it carboxylates it. And you say, well, what does that mean? Well, basically, you just basically add a glutamine molecule to this, or you add the carboxyl group to the glutamine molecule. You've just carboxylated it. I'm going to be using the term carboxylation and carboxylated as we go along here, but that's all it means, is that one step is such a crucial step. And when that happens, the glutamate becomes Gla. GLA, G-L-A. And that stands for, there's the GLA flying in there. GLA is gamma carboxyglutamic acid. So we'll just refer to it, though, as GLA. Okay, it's going to take a lot less time to get through the lecture. So carboxylation gives the GLA protein this claw. Okay, here's the claw, and here's the calcium coming in. And now the claw is going to change, and it's going to kind of grab the calcium. And this is how vitamin K is so important in terms of helping your body move calcium around to the right places. Remember, we're talking about if you have optimal calcium, optimal vitamin K, you can get your calcium to the right places. If you are deficient in vitamin K, you're missing this little claw, this carboxyl group that's going to help you get your calcium where it should be, and so it's going to end up in the wrong places. Once grabbed by the protein, calcium can be moved into proper cellular placement. Does everyone understand that slide? That's the key to the whole lecture right there. If you really understand carboxylation, and that's what vitamin K helps you do, then you understand that, wow, I need vitamin K to properly get my calcium where it should be. And it works through this very simple understanding of the structure of a carboxyl group. Now, it turns out there's three major Gla-Proteins. There's the coagulation proteins, which we've already talked about, and they're predominantly synthesized in the liver. This is why someone who has advanced liver disease starts to bruise. They can't make their coagulation proteins properly. Osteocalcin, I mentioned that earlier, that's synthesized in the bone, so you right away know that that has a lot to do with bone health. And then MPG, which I'll define a little bit later, is synthesized in cartilage and in your blood vessel walls, the walls of your arteries. This is the story that most people haven't heard about, how important vitamin K is for keeping the calcium out of your arteries and out of your cartilage and your joints. We don't need it there. It causes us a lot of problems. So this is how vitamin K regulates these blood proteins. So we'll start out mostly with coagulation. That's the one that most of us have heard the most of. And again, I'm using my little mnemonic here. K is for coagulation, only I did not invent this. Henrik Dam, a Danish researcher, discovered vitamin K in 1939 and won the Nobel Prize. And because he was Danish and spoke, Danish is a type of German, they didn't use C coagulation, it was K coagulation, and so he named it vitamin K for that particular reason. And so as we mentioned earlier, vitamin K is essential in the functioning of 8 proteins involved in blood coagulation. Now here is the key thing about coagulation that I guarantee you that maybe even 90% or more of even your regular physicians don't get. And that is, coagulation is not just one thing, it's a balance. Health, in most cases, is a delicate balance. Coagulation is a very tightly regulated bodily system. It's highly important because every day your heart beats about 100,000 times a day, and it pumps the blood through miles and miles of blood vessels. And it doesn't stop when you're asleep. All day long the blood is pumping through. Well, that same blood, if you are cut, if there's some kind of a laceration or an injury, it's very important that the blood start to clot right away, correct? But yet you don't want it to clot all those other 24 hours of the day. So there is a balance between coagulation and anticoagulation. And when that balance is out of whack, then you have problems. If your clotting fails and you get a bad laceration, you could hemorrhage to death. Or if you prematurely form a clot, inappropriately form a clot, you can get a fatal stroke, a heart attack, a pulmonary embolus. That's where a blood clot goes into your lungs. That can take you out. So really, this coagulation deal is life and death. And so it's very important that the body get it right, okay? So there's a cascade that the body does. There's kind of like a little bit of a check and balance system here. If you damage one of your blood vessels, what happens is the platelets start to stick at the rough edges of the torn tissues. The tissue factor, there's a tissue factor there that combines with factor 7, which is one of the Gla-Proteins. Prothrombin, factor 2, another Gla-protein, converts to thrombin. Fibrinogen converts to fibrin, another Gla-protein. and then long strands of fibrin trap the platelets, and you get the formation of a stable clot, and the bleeding is stopped. And so this is a wonderful miracle that saves our lives in many cases. But if excessive clotting begins to occur, if the clot just starts to spread throughout the whole system, if it kind of goes out of control, fortunately, this same coagulation system has a counterbalance in it. And these are called tissue factor inhibitor and proteins CNS. Turns out that protein CNS are dependent upon vitamin K2. These are Gla-Proteins, just like the coagulation proteins are Gla-Proteins. And so they can help begin to break up and dissolve the inappropriate clot. So you begin to see, I hope, that coagulation is not just the clot being the problem. You want to have enough coagulation, but not too much. And vitamin K works on both sides of the teeter-totter. That's the part that most doctors don't get. That's the part that most people don't understand, that you have to have optimal amounts of vitamin K to act not only as an as a procoagulant, but as an anticoagulant. So talk a little bit more about these proteins. Vitamin K promotes gamma carboxylation of both coagulation and the anticoagulation proteins. This is the delicate balance of health. And it really it's interesting, you know, we're such a drug-oriented culture, we normally think of drugs having a certain effect. It just does one thing. Well, nutrients tend to go both ways. They are what's called adaptogenic. They help the body balance out or maintain homeostasis. And this is true in terms of the coagulation pathway. The protein C anticoagulant pathway, in addition to that, also reduces inflammation. So it shares some additional properties. And we know that inflammation is procoagulatory. If you're overly inflamed, you have a tendency to form blood clots. And so part of the protein C and the protein S is to counterbalance that. And so that's why it's important that you take adequate amounts of vitamin K, and why we don't want to think of vitamin K as a bad thing. And unfortunately, a lot of people who are put on the anticoagulant drugs, they're kind of saying, you know, avoid vitamin K. You know, it's going to screw up our coagulation system. And actually, there's another way to approach that we're going to talk about in just a minute. So protein S, along with MPG and osteocalcin, are found throughout the body. It's not just in just these three systems. Actually, all the various areas of the body do make use of these special proteins. So now we're shifting into how vitamin K is very important in terms of calcification. And the way it regulates calcification in the bone is through osteocalcin. So there's two types of cells that keep your bones healthy. There's the osteoblasts, which build up the bone, and this is part of the ongoing vitamin D story. In order for your osteoblasts to work properly, they need vitamin D, but they also need a special form of thyroid called T3. So even your A and D and the thyroid that's regulated by the D and the A, these are all important in terms of bone health. And then the other side of the equation are the osteoclasts. They're constantly remodeling the bone. They reabsorb it. And what vitamin K will do is slow this reabsorption. So osteoblasts make and lay down a glue-like protein called osteocalcin on the bony surfaces so that calcium can be properly incorporated into the bone. So that should seem very obvious why K is important now in terms of making this osteocalcin. Plus, not only is it necessary for the production, but you have to carboxylate the osteocalcin, and then it has to be regulated. And vitamin K plays a role in all three of these functions. Now, here's an interesting way of thinking about osteocalcin. Remember how I said it's so important for it to be carboxylated in order for it to grab a hold of calcium. If it's undercarboxylated, it's not going to be able to do its job. So what they found is that if the undercarboxylated osteocalcin, which can be measured, if those levels are higher in postmenopausal, they are higher in postmenopausal women than in premenopausal women, and even much higher in women over 70. So right there you have a clue as to why osteoporosis is getting to be such an epidemic problem in our culture, is that probably as you get older, unless you're getting adequate amounts of vitamin K, you're under carboxylated, and so your osteocalcin is not working properly. There was a study done of 195 institutionalized women, and those with the elevated under carboxylated osteocalcin were 6 times more likely to experience a hip fracture. In addition to low serum vitamin K levels, low vitamin D levels, and poor nutritional status overall, these are what correlated with these high undercarboxylated osteocalcin levels. So we really need vitamin K, we need vitamin D, we need good protein, we need a good diet. And so it's not just vitamin K, but as part of your overall nutritional team, vitamin K plays a very important part in maintaining healthy bone. So this leads us into how vitamin K really has, I think, pretty deep implications in the science of aging. So it wasn't until the late 1990s that the first of now many studies came out which provided this new evidence for vitamin K's anti-aging potential. So the common hallmark of aging is the unhealthy soft tissue mineralization. You know how as you get older, I'm stiff and sore. A lot of that is calcification in the wrong place. So vitamin D, calcium, and magnesium require the help of vitamin K for appropriate and healthy tissue mineralization. So if we take a look at this little graph here, and remember I used the term systemic calcification, well, arthritis, kidney stones, cataracts, aortic stenosis, wrinkled skin, bone fractures, bone spurs, atherosclerosis or blockage in the arteries, senility, spinal stenosis, these are all conditions that we associate with getting older. Who wants them? If we knew that there was a way to prevent them, wouldn't we try to go that route? And yet this knowledge that vitamin K is essential for helping the body keep the inappropriate calcification from occurring is new knowledge. It's only been in the last 10, 15 years that we've even known that it happened. And remember, it took 100 years for vitamin C to be recognized to help with scurvy. So it's going to take a while, but that's part of the mission of the center, is to make it known to people that there are methods, nutritional methods, to help slow down the aging process. And vitamin K dosing appears to be one of those methods that's very easily overlooked and misunderstood by conventional medicine. The new battle cry that everyone should have is strong bones and soft arteries. And yet, as we get older, it's the opposite. It's weak bones and hard arteries. Osler, who was one of the famous fathers of medicine, said, "You're only as old as your arteries." And what makes you old is the hardening of the arteries, and that's due to inappropriate calcification. Do you see how this vitamin K talk really is relevant to everyone in this room? Hardening of the arteries equals calcification, but it's not the same. A lot of people equate plaque as just like your pipes get plugged up over time. And it's different from that. It's a type of inflammation that's occurring in the blood vessels. The smooth muscle cells that make up the blood vessels start to increase in size and number, and they play a major role in the atherosclerotic disease. And what vitamin D does is it does just the opposite in arteries and blood vessels what it does in bones. It tends to take the calcium out where it should not be, and it puts it back where it should be, thanks to carboxylation. So here's here's another very important vitamin K dependent protein. I mentioned it earlier, MPG. It stands for matrix Gla-Proteins. And you'll recall that protein S, a matrix Gla-protein, opposes and balances the coagulation cascade by having an anti-coagulation effect. So really, when you have a blood clot, it's due to coagulation that these proteins act as a kind of glue holding the clot together. And the proteins S and these other MPGs act in an opposing manner. They unglue the cellular components by pulling out the calcium that would otherwise make it stick. So it turns out that these MPGs unglue vascular plaque, and what some doctors are calling metastatic calcium, calcium that's that's metastasized to the arteries and really shouldn't be there. That picture that was passing around, you saw the little calcifications in the arteries, and the doctors, the cardiologists, are using that as an early indication of this calcification, inappropriate calcification going on in the coronary arteries. So malignant aging, that's probably a new term, but malignant aging is the loss of bone from skeletal bones with its deposition into the arteries, the plaque, and the soft tissues, the arthritic bone spurs. So the real tragedy of our time, as people age, their skeletons are becoming weaker and more porous, but where's that calcium going? It's going into their arteries and into their soft tissues. And they're feeling stiff, and they're losing their circulation, and their brain doesn't work right, and the heart gets blockages and strokes, and all kinds of bad consequences of inappropriate calcification. So this phenomenon appears to be at least partially due to incomplete carboxylation of this crucial vitamin K-dependent MPG. And so that gives us another term, UC-MPG, undercarboxylated matrix Gla-Proteins, which if you saw that word right at the first of the lecture, you'd say, forget it. This stuff is way above my head. But hopefully you understand what we're talking about now. If these proteins are not carboxylated properly, if they're undercarboxylated due to a lack of vitamin K, they can't do their job. It's pretty obvious what the problem is. Most likely due to vitamin K deficiency. Now, it's not the only nutrient. Remember that nutrients always work as a team. But vitamin K is kind of a quarterback here. Okay, it's going to get ready to receive the ball, which is the calcium in this case. There was a big study, the Riordan study in the Netherlands, where 4,800 subjects were tracked for 7 years. And they found that subjects that took an above average intake of vitamin K2, and you will find out there's two forms of K2, but they took the MN7, or it's also called the MK7. They took 45 micrograms a day. They had a 57% reduction in mortality from coronary artery disease. To me, that's pretty spectacular for just taking a vitamin. Also, the likelihood of severe aortic calcification was lower in the subjects with the higher K2 intake. And they found that if people were taking higher K2 intake earlier in life, they did not get the premature coronary calcification. This is another reason why, eating a healthy diet helps prevent heart disease. You're getting vitamin K from green things. If you want to keep the doctor away, eat the green stuff. Right, Dr. Kirby? Okay, so vitamin K appears to be an essential nutrient for preventing systemic calcification. So the anti-aging effect of vitamin K comes from the prevention of systemic calcification. So all these things that you really don't want to have, you could theoretically prevent with vitamin K. Now the three forms of vitamin K, and I'll tell you this can be a little bit confusing, but I'm going to make it pretty straightforward. Vitamin K, K1, is also called phytoquinone. It's found in plants, and that's why if you eat a plant-rich diet, you're going to get a lot of vitamin K. K2 is found in animals and in bacteria, and that's how you get the vitamin K from the intestinal flora of your gut. There are two forms, though. There's the MN4, which is synthetic, that you can get as a supplement, and MN or MK7, which is found in nature from a special fermented food called natto, which we'll talk about in just a minute. There is a third one, which we haven't even got to the whole cancer story yet, but the third one is vitamin K3. It's synthetic, but it can be formed from K1 by the gut bacteria. Now K3, most doctors say stay away from K3 because it can act as a pro-oxidant, but there are special cases where a pro-oxidant may be beneficial, which we'll come to in just a second here. So if we compare the natural and the synthetic K2, we find out that the synthetic K2 is absorbed rapidly, but it has a short half-life. It must be dosed several times a day. The amount of K2 absorbed is only a fraction often of the actual need, so you have to be eating a really good diet along with this. The vascular cells do like K2, so if you're interested in keeping calcium out of your arteries, K2 is really a good way to go. And K2 can be made from K1. So if you're eating a diet rich in greens and certain vegetable oils and nuts and seeds, you can get K1, and then K1 will convert to K2. So that's good. The latest and probably the most exciting vitamin K2 is this MN7, or also called MK7. It's rapidly absorbed, but it's got a much longer half-life in the blood. It stays around for several days. And so once-a-day dosing is effective. And it will reach blood levels 7 to 8 times higher than the synthetic K2, naturally derived from natto food, which is a form of fermented soy. And it's effective at a fairly low dose, 45 micrograms per day, whereas the Japanese have studied MN4 at about 45 milligrams per day. So you have to take quite a bit more of the synthetic in order to get the same benefits. So that's just a little bit that can help you with your decision as to which form of vitamin K you want to take. Now let's talk a little bit about vitamin K and cancer. This is a very specialized use of vitamin K, but it was shown in March of 2008 that a special drug that is considered an orphan drug by the FDA, the apitone, was found in a phase 1-2 study that if you used this drug is a blend of 5,000 milligrams of vitamin C and 50 milligrams of vitamin K3. They used it in 17 subjects who had end-stage prostate cancer who had failed other forms of local treatment. And so in two instances, their PSA kept going up in spite of therapy. But when they took this apitone, the rise in the PSA velocity decreased in 13 out of 17. And of the 15 that continued the apitone past 14 months, there was only one death. So there's some indication by this study that vitamin K3 can be used along with vitamin C as an anti-cancer agent. I mentioned earlier the reason it's not used a lot is that it's a pro-oxidant, and it was actually K3 that for a while was used for the injections of the neonates, and it was causing problems. So they had to use a different type of vitamin K. This is just a little bit to explain. I'm not going to try to get into a lot of chemistry, but vitamin K3 works as a pro-oxidant in the same way that high-dose vitamin C works as a pro-oxidant in cancer. The K3 donates some of its electrons here to copper, and it reduces the copper. The reduced copper interacts with peroxide, and you get the formation of the hydroxyl radical, which is a potent anti-cancer agent since cancer cells lack catalase. And as long as you have more vitamin K3 coming in, you will redox cycle and continue to form large amounts of the hydroxyl radical. Now, when you combine K3 with vitamin C, you can do that at about 10 to 50 times lower dose when you combine it with vitamin C. So vitamin C and vitamin K3 are a very good combination. And together they act kind of like a water wheel. As long as you're putting the vitamin C and the vitamin K in, and it's turning that redox cycle wheel that I showed you, you'll keep producing the hydroxyl radical, which can act as an anti-cancer agent. In addition, vitamin K they've discovered something very unusual. There's a word up here that probably none of you have ever seen before called autoschisis. And what it means is there are different ways that cancer cells die. The most common way is through apoptosis, which is a kind of cell suicide or programmed cell death. Excessive oxidative stress triggers a special gene to turn on, and the cancer cell dies. And this is how most chemotherapy works. If you use really powerful chemotherapy, you can just kill the cancer cell outright, and this is called necrosis, but it has a lot of secondary inflammatory effects. But what's unusual about vitamin K is that it will kill cancer cells through a mechanism called autoschisis. And you have to be careful how you say that. What happens here is that in the presence of adequate amounts of vitamin K, the cell just extrudes its cytoplasm, and the liquid part of the cell is just dumped out, and all that's left is the nucleus, and it just can't survive there by itself. And so it's a new, unique killing mechanism for vitamin K. There's a number of other uses that have been looked into: rheumatoid arthritis, It has anti-inflammatory effects, so it can work on a number of these chronic inflammatory illnesses. It seems to reduce the toxicity and increase the effectiveness of the bisphosphonates. These are the Actonel and Fosamax that are used for osteoporosis. It reduces intracellular calcium, as I mentioned earlier. It decreases the cancer risks of Coumadin. There is some cancer risk associated with Coumadin. It improves fracture healing, more powerful than CoQ10 as an antioxidant. It may support immune health, and it may enhance memory. So these are things I didn't even get into, but there are some exciting new horizons for vitamin K. So there's a couple questions that I assumed were just going to come up, so I thought I would just ask them ahead of time. Can I take too much vitamin K and end up with a blood clot? This is going to be the most common question that people have when you start mentioning about taking higher doses of vitamin K. They're saying, well, wait a minute, isn't that K, doesn't that help with coagulation? So maybe if I take too much, I might end up with a blood clot. But once the coagulation proteins have been completely acted upon by adequate vitamin K, they're 100% carboxylated. If they're 100% carboxylated, you can take all the more vitamin K you want, and the proteins will not become more carboxylated. They can only become 100%. And so there is no additional coagulatory effect by continuing to increase your vitamin K, and that's why on the recommended daily allowance, there's no upper limit of vitamin K for the average person. Is the optimal vitamin K dose for clotting the same as for bone health? And the answer to this is really, it's a big no. Only a small amount of vitamin K is needed for proper blood clotting. That's why most people can eat a pretty crummy diet and still have good coagulation of their blood. They don't need that much vitamin K for clotting. But for osteoporosis prevention and for keeping the calcium out of the arteries and out of your tendons and cartilage and whatnot, you need much higher dosages. And this is new evidence, this is new information, that the dosage of vitamin K you need to protect your bones and your arteries is much higher than what you need to have normal coagulation. And so finally, this is the big question. I take Coumadin to prevent blood clots. Should I avoid vitamin K? Because everyone who gets put on Coumadin gets a little paper that says, do not use greens because it's going to mess up your what's called your INR, your ProTime. Well, it turns out that Coumadin is an anticoagulant drug that actually inhibits normal K function. That's how it works. It blocks vitamin K. This impairment, unfortunately, can increase your risk for osteoporotic fractures and abnormal calcium deposit in the arteries and valves. And this is documented. People who are on Coumadin or warfarin for an extended period of time have a higher level of calcification in their arteries. They have a higher risk for osteoporosis. And so wait a minute, they say, what am I going to do? The doctor says I can't take vitamin K and I should stay off the greens and all the food sources for it. However, new research, again, has shown that proper dosing of the long-acting K2, this MK or MN7, can actually stabilize your INR if done in cooperation with your prescribing doctor. So you don't want to go in there with just large doses of vitamin K, but if you can get a doctor who will listen to you and think about this, remember that vitamin K has an anticoagulatory effect. It's going to work with your Coumadin. It's going to help you prevent blood clots. But you don't want to go in with a large dose because you're going to have a big change in your ProTime. But if you start with small doses, work your way up gradually, do your ProTimes, work with the doctor. What they found is that people who are on this long-acting K2 had much more stable ProTimes. You've heard of people going in like every week to get their ProTime tested, and then one time it's too high, and another time it's too low. It's probably due to fluctuations in their vitamin K. And if they had a nice stable source of good vitamin K, they would have a better ProTime and a more stable anticoagulatory effect. So it's not mutually exclusive. Now I do have to warn you that most doctors won't know this, and so you're going to have to educate your doctor. Food sources. K1 is the major dietary source, but it's very poorly absorbed. Green leafy vegetables and some vegetable oils are the major contributors of dietary vitamin K. If you consume a lot of hydrogenated vegetable oils, that can decrease your absorption and reduce the effectiveness of the vitamin K. I've got a little table here to kind of give you an idea of some of the sources of vitamin K. I've also put a table in of what the adequate intake of vitamin K is for the different stages. I really think these are very, very minimal amounts, especially depending upon how old you are and what conditions you're trying to deal with. Now, for infants and adolescents, it's probably fine, but if you are at an age to where calcification is an issue with you, these amounts may not be enough, and this is something you would need to talk over with a nutritionally oriented physician. K1 is available in most multivitamins, or not in most, but in some multivitamins, and then there are bone vitamins, multis, that have higher amounts in them. K2 is available. We have K2 upstairs, and it's in a 5 milligram dose upstairs. The Japanese use the 45 milligram dose, but again, you could start low and kind of build yourself up gradually. So that's a very common source that you can find. And then the latest one that's been showing up lately is the MK7 K2, which is the natural form that's derived from natto. And that has the several advantages that I mentioned earlier. Toxicity. There is no known toxicity associated with high doses of K1 or K2. You could have an allergy to it. And of course, if you're on Coumadin or warfarin, you have to be very careful and work with your doctor in using it. K3 can act as a pro-oxidant and interfere with glutathione, but again, we can use that to your advantage if you have cancer, and you want to do that with a doctor. The metadione, which is the K3 given by injection, has induced liver toxicity, jaundice, and hemolytic anemia in infants, and that's why that was actually pretty controversial there for a while. No tolerable and it caused it because it's a pro-oxidant. No tolerable upper limit of intake has been established for K1 and K2. There are a number of nutrients that can interact with vitamin K. Vitamin E and A can antagonize vitamin K because vitamin A interferes with K absorption, and a special form of vitamin E inhibits some of the carboxylase enzymes. One study in adults with normal coagulation status found that supplementation with 1,000 units of vitamin E for 12 weeks decreased gamma carboxylation of prothrombin, and that's why people who take a lot of vitamin E, if they cut themselves shaving, they can bleed a lot more. Vitamin E is considered kind of a natural anticoagulant for this very reason. Hemorrhage has been reported in a man taking 5 milligrams of Coumadin and 1,200 units of vitamin E daily, so you have to be real careful if you're going to use large doses of E along with Coumadin. There's a number of drug interactions when given to pregnant women. Coumadin, anticonvulsants, rifampin, and isoniazid can interfere with fetal vitamin K synthesis, which places newborns at risk. Prolonged use of broad-spectrum antibiotics may decrease vitamin K synthesis by intestinal bacteria. I'm very suspicious of this because there's a lot of antibiotics in the food we eat these days, and so our gut flora is probably not what it used to be, and we're probably not making as much vitamin K as our ancestors did. Cephalosporins and salicylates can decrease vitamin K recycling by inhibiting this enzyme. And then here's Dr. Krier talked a little bit about various ways to cause your fat to be excreted more rapidly, but you've got to be careful with some of these medicines like cholestyramine or the orlistat or taking a lot of mineral oil. That's going to decrease your absorption of vitamin K, so be quite careful about that. I thought I'd put up, just to finish here, the Linus Pauling Institute's recommendations, just as a kind of, they're very sound recommendations. Multivitamins contain 10 to 25 micrograms of vitamin K, while the bone supplements contain 100 to 120, and that's generally very true. To consume the amount of vitamin K associated with a decreased risk of hip fracture. The Framingham Heart Study gave people they made sure they needed to get about 250 micrograms a day. You would have to eat a little more than a half a cup of chopped broccoli or a large salad of mixed greens every day. That really wouldn't be that hard, to get a good dose of vitamin D just from your diet. Through the dietary intake of vitamin, although it is required for optimal functioning of all vitamin K-dependent proteins, we don't know what that dose is. What the Linus Pauling recommends is taking a multivitamin mineral supplement and eating at least 1 cup of dark green leafy vegetables daily. And also to be careful and not use a lot of, they found that if you use an excessive amount of saturated fats, you might decrease your intake of vitamin K and increase your risk of heart disease. Final slide. The older adults, 65 years and older, are at increased risk of osteoporosis, hip fracture, and also calcification of arteries. So the above recommendation for a multivitamin, mineral, and at least 1 cup of dark green leafy vegetables per day is especially relevant. I think that's a nice way of saying, think about taking more, folks. So, but again, I would do that with a little bit of caution in the sense if you're on any kind of a blood thinner, with the exception of maybe aspirin. My wife asked me last night, well, would aspirin, a baby aspirin, make you too thin? But baby aspirins work on the platelets. And so this works on the proteins. So there are different mechanisms of anticoagulation and coagulation effect here. So really taking a baby aspirin shouldn't be a problem if you're wanting to take higher dosages of vitamin K. So with that, I'm sorry it was such a whirlwind. I hope there was something there that you learned. And Jan and Nancy have got microphones, so please feel free to ask some questions about vitamin K. Yes, ma'am.
I have heard individuals say that their blood test indicated they have high levels of calcium. What is the appropriate response to that?
Well, if you've got high levels of calcium, there are other causes for that besides just vitamin K problems. There are a number of hormones in the body and glands. The parathyroid glands regulate calcium, and so there are other reasons for that. That's probably a different story than the vitamin K story. So you need to go see your doctor about that.
I have a friend who has Crohn's disease, but it's thought to be well controlled. She had surgery years ago for Crohn's. She ended up in the hospital with a big clot in her thigh. Previous to that, she had cut her thumb, and it bled and bled and bled. Couldn't get it to stop. Now she's taking shots every day to keep her blood thin. Her coagulation studies were off the chart. So here she has a big blood clot in her thigh, and yet her coagulation studies are off the chart, and she had a hard time keeping she had cut her hand. And so it's kind of two different things.
Right. It's a huge dilemma because on the one hand, the person has a bleeding disorder because they've got inflammation in their colon and they can't absorb the vitamin K that they need, and so they're bleeding, but yet they lack the anticoagulant effect of vitamin K, so they formed a clot. So they've got both sides of the teeter-totter are affected, and from the conventional medicine point of view, they're going to put in an anticoagulant, but she's going to be at risk for more bleeding. So I think that'd be a perfect case for where careful use of vitamin K would be very beneficial. But again, you have to understand that vitamin K works on both sides of the equation.
Would probiotics help her?
Probiotics would be, if the doctors were unwilling to do vitamin K supplements, probiotics to improve her gut flora would be very helpful. Yeah, and just consuming in moderate amounts some of the vitamin K containing foods.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.